Alright, ladies and gentlemen, I guess this is it. Welcome to Andie, new kid on the block. This is going to be my new platform, my new YouTube channel named Andie, and this is a platform where I'm going to be sharing most informational videos on not just on one thing but various things, simply because I am versatile in nature. All things medical, spiritual, beauty, music, you name it, it's all going to be here. This is almost like your one-stop channel. So this is my very first video right on this platform, and it's gonna be a medical video. I think the advert sells it out, what it is that I'm gonna be talking about. So I'm going to be talking about diabetes mellitus. Most of us, especially in South Africa, I think South Africa is ranked 3rd, last time I checked, as the most obese country in the world. And with that being said, it should predict that most of our population, one way or the other, will have complications of that, whether it be in the form of diabetes or obesity complications, cardiovascular related issues, or diabetes mellitus. So basically there are like 3 forms or 4 forms or 5 forms depending on which source that you are using, but I'm simply going to try and talk about 3 kinds. So you have diabetes mellitus type 1, type 2, and of course gestational diabetes mellitus, but I'll try and focus more on type 1 on this video. If time does allow us, I'll get into type 2 and of course gestational diabetes mellitus. So what happens is you have risk factors for these diseases. If you have like sedentary lifestyle and healthy lifestyle, all of those things will contribute, but more to your type 2. So what happens with type 1 diabetes mellitus is you have a hyperglycemic state, but secondary to an autoimmune process in your body. So what happens is normally when you consume food, right, it goes through your mouth all the way to your stomach, but then it has to be absorbed, and whether it be fat or proteins or carbohydrates, they have to be broken down into their simplest form, which is glucose, and it has to be absorbed either from your stomach or your small intestine, and this is absorbed into your blood, or rather circulatory system. And now the cells, remember your cells come together to form tissues, to form organs, to form systems. The cells have to now take in the glucose and form ATP so that the cell can work, so that your normal enzyme activity, your whole physiology can be maintained. So what happens in type 1 is that you have an autoimmune process such that which attacks the pancreas. Pancreas is an organ that you have in your abdomen, which is responsible for producing insulin. Insulin is that hormone which helps the glucose that would have been absorbed into your circulatory system that helps the cells absorb the glucose. I hope I'm saying it in the most simplest form that you can understand. So basically the cells, they have this GLUT4 receptor to which insulin acts on, and then you have the glucose from the blood taken into the cells. So if now you don't have insulin, that means you're going to have sugar built up in your blood, and that is a problem. All right, that is a problem because now your cells will not be able to take in the glucose. You might have heard people say type 1 diabetes mellitus is an insulin dependent form of diabetes. So that is what it means. You have the sugar, but your cells cannot use it. So what happens now is that either it can be diagnosed early in life. Of course, family history has been shown to be a factor as well. So it's usually diagnosed in children, or rather people less than the age of 20. So once your doctor diagnoses you of type 1 insulin diabetes, it means that did I say insulin diabetes? Once your doctor diagnoses you of type 1 diabetes mellitus, it means that you're going to have to inject yourself of insulin. Of course, now you need to now learn how to live with the disease, the food that you must eat, and how to check your sugars, how much you should inject at what time. So you have long acting and short acting insulins, and it depends on what your doctor would have started you on. So what matters is that you should constantly usually with type 1, we usually give them the glucometers so that they can monitor their sugars at home. So especially if this disease is diagnosed early on in life, the family has to be there for the individual, because you are young now. You have to constantly inject yourself. You have to be constantly aware of what you eat. You cannot do this, you cannot do that. So it can affect one psychologically, especially if they're still going to school. It really can affect even how they perform at school. So if you have a cousin or a friend who's on insulin or who has any form of disease, really, please be there to support them mentally as well. So one of the things I want to talk about is what happens then if you are not taking your treatment correctly, or if it happens that your diagnosis was delayed and now you come in with complications. So what happens is, so you have this hyperglycemic state, right? Okay, let's make an example of somebody who's already taking their treatment. Okay, so let's say for one reason or the other they stop taking it, whether because of availability or patient what do we call it, patient behavior associated with disease, you know. So what happens is, because your body needs energy, it's going to start now breaking your fat to make energy. Okay, as it breaks down fats, like there is byproducts of that process, and the byproducts are ketones, and the ketones will be deposited into your blood system and they will bind to some of the proteins. And hence you see that part of when a patient comes in diabetic ketoacidosis, DKA, which is one of the complications, life-threatening complications. Hence I'm making this video so that you take your medication, so that if you are type 1 diabetic, you may act and behave better, or if you know someone, you may know what to tell them. All right. Oh please, and another disclaimer, didn't remember to make this to say this at the beginning of the video, is that none of my videos constitute as medical advice, neither should they be used as tutorials for those who are still under training. All right. Now that we have gotten the disclaimer in the way, or out of the way, however you want to think about it, is I was still trying to explain the pathophysiology of the complications. And because yeah, and basically that is what happens. And so what happens with that process is that you have this a pH. Don't quite remember what pH stands for again, but it basically refers to the acidity or alkalinity of the blood. And enzymes work at the most maximum, or what is this optimized pH for them to work maximally, which is 7.35 to 7.45, and I think that's the value globally. So what happens is, when you are diabetic and don't take your medication, you disrupt that equilibrium that keeps you at 7.345 to 7.45, and at some point you become acidotic, metabolically acidotic, and what happens is your respiratory system compensates by trying to blow out that excess carbon dioxide that you would have formed in your system. I think it has to do with the bicarb, how the bicarb, I'm not sure exactly what it does. I haven't revised that pathophysiology in the longest time, but basically the equation shifts to be more acidotic, and hence the patients will come in what we term as Kussmaul breathing. And so your pH will be distorted, your electrolytes will be distorted, and you're going to need fluids and insulin and all of that management to help you get back on track. So what I'm saying this so that you can, oh optimize your health. All right, and there are other complications related to related to diabetes in general. I think I do have time just to tap into type 2. So type 2 is usually diagnosed in elderly patients who are obese, sedentary lifestyle, positive family history, all of those things. And it's almost like saying diabetes is a lifestyle disease. All right, and there are complications that I want to talk about which are so severe and at times very emotional. So diabetes can cause you to have stroke as a complication, myocardial